Endobronchial EBUS, a revolution in the pulmonary diagnostic. I will be discussing endobronchial ultrasound or EBUS, a transformative tool in modern pulmonary medicine. EBUS has dramatically changed how we approach mediastinal lymphadenopathy, lung cancer staging, and granulomatous disease like sarcoidosis and tuberculosis. It offers minimal invasive real-time guidance to obtain diagnostic tissue, reducing the need for more invasive procedures like mediastinoscopy. So, what is EBUS? EBUS is a bronchoscopic technique that combines ultrasound imaging with bronchoscopy to visualize structures adjacent to the airways, especially mediastinal and hilar lymph nodes. There are two types. One is a convex probe EBUS, CP EBUS, used for transbronchial needle aspiration, that is a TBNA of lymph node. Second is a radial probe EBUS for peripheral pulmonary nodule used with a guide sheet. Our focus today will be primary on the CP EBUS used for real-time TBNA. So why EBUS? Clinical indication. EBUS is indispensable in several clinical scenarios like lung cancer staging, assessing mediastinal hilar lymph node, stations 2R, 2L, 4R, 4L, 7, 10R, oblique L. Diagnosis. If the primary lesion is peribronchial sarcoidosis, sampling lymph node in stages 1 and 2, tuberculosis and others, granulomatous disease, differentiating TB from sarcoidosis when radiological features overlaps, lymphoma, metastatic disease and unknown mediastinal masses. Mediastinal infection, reactive lymphadenopathy. It provides diagnosis, staging and restaging, all with minimal risk and high yield. Procedure and technique. The procedure is usually done under conscious sedation or general anesthesia depending on patient and center preference. The EBUS bronchoscope has a convex ultrasound probe at its tip and a needle channel. Under ultrasound guidance, Lymph node stations are usualized, measured and sampled with a dedicated 21G or 22G needle. Real-time visualization ensures precise targeting and avoids vascular structure thanks to the Doppler assistant. Samples are sent for cytology, histology, gene expert, AB stain and culture, flow cytometry or PCR depending on clinical suspicion. Rapid on-site evaluation, that ROSE, improves adequacy and diagnostic yield where available. So, advantage of EBUS over conventional TBNA and mediastinoscopy. Real-time guidance ensure high accuracy, minimal invasive and safe. It reduces need for surgical mediastinoscopy, can be performed on an outpatient basis. Better access to multiple lymph node stations. Cost effective in long run given lower complication rates and hospital stay. Diagnostic yields and limitations. In lung cancer, EBUS TBNA has a sensitivity of around 80 to 94% and specificity near 100%. In sarcoidosis, diagnostic yield is 80 to 90%, often superior to transbronchial lung biopsy. In tuberculosis, especially in extrapulmonary cases or atypical presentation, EBUS can help distinguish TB from mimics. Limitations include limited access to certain stations, for example, para-aortic, then requires operator expertise. Occasionally, sample adequacy can be challenged without rows. Lymphoma diagnosis may require larger core biopsies or surgical follow-up. And the last, complications and safety. EBUS is generally very safe. Minor complications, cough, sore throat, transient hypoxia, rare bleeding, infection or pneumomediastinum. No major vessel puncture due to ultrasound and Doppler guidance. Overall, complication rates are far lower than with surgical options. Future direction and innovation. Elastography differentiates malignant from benign node by measuring tissue's stiffness. Cryo EBUS for obtaining larger biopsy sample, molecular testing on EBUS samples. EGFR, ALK, PD-L1 is increasingly feasible as precision medicine evolves. EBS will continue to be central in thoracic diagnostic and personalized care. So, in conclusion, EBUS has revolutionized the evaluation of mediastinal and hilar lymphadenopathy. It is safe, effective, minimal invasive, and yields high diagnostic accuracy, whether it is for lung cancer staging, diagnosing sarcoidosis, or evaluating mediastinal TB. EBUS has become an essential tool in every pulmonologist armamentarium. Thank you.